You are an interventional cardiologist, a heart doctor, and you really love fasting. Do you think that fasting is the best way to burn visceral fat? Absolutely. Because visceral fat is connected to coronary artery disease, and that's what I work on all day long. Visceral fat has been identified as a major risk factor for developing cardiovascular disease. Not only cardiovascular disease, cerebrovascular disease, brain function, even some cancers. So that data came later on, but I saw that it's the visceral fat patients who are having the worst coronary artery disease, the highest coronary calcium scores, the highest incidence of plaque rupture, and on plaque analysis, I was seeing the correlation between the two and worked out the chemistry. And sure enough, visceral fat is inflammatory. And that became the root of my prevention program, that if I get rid of that, will my outcomes get better? Because ultimately, I just got tired of stenting patients all day long and seeing that they keep coming back with new and new progressive disease. So visceral fat has many causes of visceral fat. So recently we put in a DEXA scan machine in my office to specifically look at the amount of visceral fat that you have. And we now can quantitate it on the DEXA scan and follow it longitudinally with the interventions that we'll talk about. Because I do want to get rid of visceral fat. Visceral fat is poison. You're not designed to have visceral fat. And in your design, it was the intermittent fasting that actually gets rid of visceral fat. Visceral fat is pathological. You see, basically, we should think of fat as three locations of fat. The first one is the regular fat, the fat that people have under their butt, for example, or in their thighs or under their arms. And that's just subcutaneous fat. And usually that type of fat is not very inflammatory. So if I did a biopsy, I'll find some fat cells in it, but there's not much inflammation. Then the second type of fat is the visceral fat. This is the fat around your internal organs. I call this ectopic fat. This fat is in your liver as well, and there's fat in your and around your pancreas, and the belly protrudes outwardly. Ectopic fat is also the fat around your coronary arteries. Now there's the connection with me also. So this ectopic fat, the very word ectopic, means it shouldn't be there in the first place. So then you got to ask yourself, let's reverse engineer this. What made that fat go there in the first place? How come people never had that before? Maybe they were just obese, but they were not metabolically sick. That's the problem. When you are metabolically sick, you're going to have visceral fat. So visceral fat equates to metabolic illness. So again, keep reverse engineering. So now you have the phenotype. The phenotype means the finding of visceral fat. So you say, what made that happen? Metabolic disease. Then you say, what caused the metabolic disease? And that's when you come to high insulin levels, high glucose levels, toxicity, lifestyle, circadian pattern disorders, basically even metabolic endotoxemia, which means leaky gut. Any inflammation in the body is going to give you a metabolic derangement. The metabolic derangement is going to give you visceral fat. Visceral fat is inflammatory. If I biopsied it, it's full of white cells, macrophages. If I did a chemical analysis on it, it's full of interleukin-6, tumor necrosis factor, and other cytokines that have been produced because that fat is inflammatory. It's not normal fat. It's not normal to have that. So my interest in visceral fat is because I know that coronary artery disease is an inflammatory condition. How? Because if you analyze the plaque, it's inflammatory. There's T cells in it, there's B cells in it, there's macrophages in the plaque. So all this comes down to inflammation and the molecules that drive inflammation. So that's where I got very, very interested in visceral fat in the first place. And that's why we now, on every cardiac patient, we look to see how much visceral fat you have. And then to answer your question, what's the best way to get rid of visceral fat? Now, of course, a multi-way, multiple ways, but my favorite way is fasting. Because if you look at other ways to get rid of visceral fat, which is to say, okay, let's get rid of your metabolic condition and let me give you some drugs or supplements to get rid of that. Yes, they are going to work, but the king of all these interventions is fasting. Not only is fasting anti-inflammatory, so there you go, I got rid of your inflammatory molecules, it also gets rid of the fat itself, because you start burning that fat first. So you've seen people who want to lose weight and they can't lose weight everywhere else, but the first place they'll notice is the stomach goes down when they go on my fasting program. So fasting will get rid of the fat itself as well. Fasting also gets rid of bad bacteria in your gut. So it resets your gut microbiome because often that's the source of your inflammation that's happening. Fasting will also improve your stem cell mobilization. It will also get rid of zombie cells in your body and thereby reduce inflammation because it is one of those autophagy as I call it, autophagy ketone. We'll talk about that. So it does that also. And of course, when you're fasting, you're not taking in more toxins. So if you're putting on more toxins because you're eating what you can't avoid, let's say, and they all have chemicals in them and they have pesticides and herbicides and some plastic wrappings on them, oh, you're fine. When you're fasting, you're getting less load of poisons as well. So fasting, just to me, just hits on every aspect. So look, you have a choice. You can still keep eating very frequently and go for the chemicals and all the other things we're talking about. I do those too. Also, don't get me wrong, because I'll give you some of my chemicals that I like to give you in the form of supplements, not drugs, supplements. But fasting is going to hit everything, and we can talk about all the various things that fasting does. I really want to get more into fasting, but you did mention the reason why we do get visceral fat, the belly fat, and all these chronic diseases. And you mentioned numerous things, but I want to first focus on insulin resistance, too high of insulin. Can you walk us through the pathway how insulin resistance can drive visceral fat? How does it happen? So the very molecule, define what is insulin. Insulin is a storage molecule, okay? It's a storage molecule. It will take your blood sugar and it'll store it. It gets it out of the bloodstream. And when you have too much calorie intake, meaning that you're eating too frequently, you're eating foods that are made up of simple sugars, processed foods, refined products, where the glucose comes in and immediately stimulates your insulin level. So insulin level goes really, really high. Now it's going to take all that glucose and put it into storage because it has to get it out of the bloodstream. And the first place it'll put it into is going to be your liver and your visceral fat. So insulin puts it away. Now what happens is that when you keep doing this, the insulin rise is going to be higher and higher each time. So the first problem we did is we start eating too frequently. So the insulin level goes up after you eat, which is fine, and the sugar level's coming down, but the insulin stays up for about 4 hours, then finally comes down, but then you eat again. So that insulin doesn't even get a chance to come down to normal, and you're eating again. So now your insulin level goes up even higher, and you require more insulin because it never really came down to normal. See, when the insulin level comes down to normal and then you eat, you're going to get a smaller insulin rise. Now, this is critical to understand why fasting works, because when you're fasting, you don't make any insulin. So now your insulin level is way down. And now you eat that same meal that, let's say, you had a few days ago, you'll produce much less insulin. So what causes this high insulin level in the first place is, number one, eating too frequently and snacking all the time, never giving that insulin a chance to come down. That makes sense because we were not designed to eat every 3 to 4 hours. We were probably designed to only eat once a day or maybe twice a day at most. And I'll show you the data on that because that's how your body is supposed to work. The second thing is what we're eating is wrong. So we're eating too frequently and we're eating all those processed modern day foods. These foods that have been around for about 50 to 60 years, all processed, all refined, stripped of all their nutrient value, especially fiber, causing this high glycemic index, and therefore everything is pushing towards a higher and higher insulin level. So now even kids are having type 2 diabetes. 10% of obese children now have type 2 diabetes. Never heard of before in children. Look at youngsters, look at teenagers, look at people under the age of 30. Many of them who are overweight, especially with truncal obesity, have hyperinsulinemia. So you should look around, and when you see the one with the protrudent abdomen, he's got hyperinsulinemia. So high insulin level has become pathological. It's high all the time. So it's a storage molecule, number one. It's going to put away everything into ectopic fat, visceral fat. That's its job. Its job is to do that. But insulin is also a very sinister molecule. It's also a growth factor. So it causes the smooth muscle cells in all your blood vessels to proliferate. So it causes atherosclerosis. The arteries start getting hardened. So macrovascular disease, which is large vessel disease and medium-sized vessels, the growth of the plaque is driven by insulin. Insulin causes the smooth muscle cells to divide. It makes you grow. Insulin is a growth factor, makes you grow. Also, insulin depletes the blood vessels of nitric oxide. So at high insulin level, it depletes nitric oxide. Now, nitric oxide levels go low. What is nitric oxide? It's anti-atherosclerotic. It's a vasodilator. Two things. So now the tiny blood vessels don't dilate properly. If they don't dilate, because that's all a property of nitric oxide, you're going to get nitric oxide depletion. So small vessel disease, which is endothelial dysfunction, starts creeping in. And this is very important to a cardiologist because it causes microvascular disease in the heart, of course, but in your brain it causes brain fog. In men, you can get erectile dysfunction. Basically, the tiny capillaries lose their ability to vasodilate and relax. Vasodilate and relax all over the body, including your brain. So nitric oxide depletion has many causes, but hyperinsulinemia is one of the major causes of nitric oxide depletion. So we can talk about nitric oxide. I know you have an interest in nitric oxide too, but so the year, I'm linking everything together to show you how nitric oxide and insulin all go hand in hand. And almost invariably my patients that come in whom we can measure the ability of your tiny capillaries to vasodilate and vasoconstrict, which we call flow-mediated vasodilation. Sometimes we do a swab in their mouth and we can actually give them an idea as to how much nitric oxide they have. It is correlated with insulin. So when I do the blood test, your insulin is going to be high, and then I look at the phenotype and I say low, and look, you got a belly that's sticking out, your arms are nice and thin, you have visceral fat. And then we do the DEXA scan or a liver ultrasound and we see that they have visceral fat. So you see, you link all this together and you can see the pathology at the biochemical level, microvascular level, macrovascular level, and this is a major, major epidemic. And when I started my fellowship, we didn't see so much of this and we never actually, they were there. But the epidemic now is so bad that I see that my patients who are in their 40s and 50s having visceral fat, nitric oxide depletion, very high insulin levels, and they're aging prematurely. And by the way, insulin has also been linked to cancers. So you basically, with insulin being so high, you get mitochondrial dysfunction. So it gets a little complicated here, but basically mitochondrial dysfunction then causes the downstream effects of reactive oxygen species, which worsens things, but also can lead to certain cancers. Because if your mitochondria are not working very well, your body is going to go to the glycolytic pathway, and that's where cancer cells, they thrive on that pathway. The cancer cells don't use mitochondria, they use the glycolytic pathway. So we all have some cancer cells and they just start growing real fast, and our immune system doesn't wipe them out. And there's a whole reason why our immune system is also not working very well, which we can talk about. But basically, you can see that insulin, visceral fat, nitric oxide, blood vessels all dovetail together. So if you really liked and enjoyed this video, then check out this clip because I think you'll find it very helpful. And of course, if you want to see the full video, this is where you'd go. Now, also don't forget to check out my website because there's lots of educational materials and resources there. You'll also find how to contact me or have a consultation with me. So please do check out my website. Thank you.